Thank you very much for inviting me here. Thank you very much for the welcome to country and for inviting me and welcoming me to be here from the east to the west. Perhaps I'll just start off with a couple of broad framing things and then move to having a conversation with the panellists, people who've spoken. Just to follow up on Stephen's, the quote that Stephen gave that I wrote. We have come to this, we meaning quite a large team of people I work with at UNSW, over the last 25 years, in fact 30 years really, of looking across homelessness, criminal justice, mental health, disability, really all of the things that can cohere and make life extremely difficult for a number of people in our community. That we began to hear about 12, 15 years ago about complex needs. We began to think, yes, we can see that. We can see that there are people in the research that we do, large cohorts and a variety of ways of trying to understand this. We can see that that people gather around themselves, so to speak, a range of things which make their lives extremely difficult. But one of the big pieces of work we've been doing for the last almost 10 years now is looking at a large cohort of people across their whole lives and getting all of the data that we can get from all of the agencies that we can get it from across their whole lives. So what do we see? We do not see that people are born with complex needs. What we see is that people are born into circumstances in which either they can be supported if they have a disability, or if they are disadvantaged, or if they live in, or there's stigma, or a range of things, that they can be supported, and that socially, structurally, we can make a difference to people's lives. Or things can begin to accumulate. Now there is quite an old social theory called cumulative advantage and cumulative disadvantage. And it's so applicable here that what we begin to see is that there is an accumulation for people of things that are not addressed or things that they cannot address themselves for various reasons, and we can go into some of that later. So what we see by the time, people are in their late teens, turning up to ED, into the prison system, out of home care, that we have created this system of complex support needs or complex needs around people. So people don't drop from the sky with these things. These are socially constructed. Why do we know that? We know that because if your parents are middle class or wealthy, on the whole, you do not end up with those concerns because you have supports, because there are a whole range of things that your parents, your family, your school, and so on can do to support you. So these are the sorts of things that I really would love to now discuss in more detail with the panel, because what I've been hearing is absolute music to my ears, that there is a real intention to make integrated and cohesive service arrangements and to make structural change, because that is the only way these things will be addressed. It's not individual by individual, although each individual needs support. It is how do we prevent it happening in the first place, and then if it does happen, how do we begin to move somebody into the kinds of supports that they need. so that it doesn't continue. So I guess I'd, maybe just start at this end here and move along. So Amanda, your frequent flyers, we did a similar research piece in Sydney quite some years ago and found exactly the same that you have found. And this is the case across the world, that we see it's a horrible term, frequent flyers, but people who come very frequently, often brought by the police. So I'd like you to dig down a little further and talk about what is it about the housing, the 50
lives, 50 homes.
Yes. And the structural approach to that is making a difference, and that you could see being implemented more broadly.
So I think 50 Lives, 50 Homes addresses the very complex end of chronic homelessness. So we triage people into categories of acuity and complexity using a tool, and then 50 Lives, 50 Homes only takes the worst end of that and looks at those specifically. So it's been very successful so far in getting people into long-term housing and keeping them there with supports. The things that work with that are, one of them is that the patient has, or the client has, a caseworker who actually negotiates with all the different agencies, because many people with complex needs are simply unable to get past the difficulties of being sent to place after place after place, to staying on telephone lines, to answer questions that they don't know the answer to. So it's actually very hard to negotiate the agencies generally that are needed to get somebody the services. So the caseworker can then call on different things. So I see it as a bit like a lake, a nice smooth lake with homelessness on one side and stable housing on the other. And the client is like a swan or a duck that's sailing, just swimming across this smooth lake. But underneath, there's a whole lot of work that's happening under the surface of the water that's happening to actually get that person the seamless passage across, engaging different agencies, smoothing the way, sorting out problems. And a lot of that sorting out of problems is done by, essentially with 50 Lives, 50 Homes, is sitting down for what are relatively short meetings and actually doing case management with 15 different agencies. So Centrelink sorts out one thing, you get some input from people who can provide AOD services, housing services, etc. So that's very successful for people. The other is not expecting, in support services, people to have their crises in business hours, because they actually occur in evenings and weekends. So you have after-hours support to sort of bridge the gap. And often it's small things, in fact, that cause people to slip through the cracks. It might be that something bad happened after hours, or it might be $200 that's needed to top up the amount for a deposit for something. It's often tiny little things, but people are, well, we don't pay for that. Oh, no, that's not our problem. So it's having a real mindset of there must be a way. There simply has to be a way, and we just have to find it. It's not good enough to say, we can't find anywhere for this patient, so they'll just have to stay in hospital for another week. I think it's where people problem solve, and instead of saying we can't do it, they say there is a way of doing it. There must be.
Yes. So just to pick up a little on that, and maybe everyone else might like to comment, is that scalable?
Yes, I think it is. And
so we might ask whether people would think it's scalable. The second thing is to point out that one of the things that you've commented on there refers very clearly to my comment that Stephen raised, that we create.
We
create these problems because we expect people to fit in our boxes or our silos or our time, and that's not their fault that they're not.
Yes,
and therefore,
absolutely.
So one of the things that you've commented on there is that you, this approach is one which takes into account the people
yes. Yes.
and their situation rather than your needs as an agency.
Yes, because one of the problems for people experiencing homelessness is that they're expected to go to lots of different agencies, beg, plead, tell their story over and over again in all its traumatic, difficult sort of ways. And I think having navigators through the system, which in the case of 50 Lives 50 Homes is a caseworker, is incredibly important, because actually it's also easier for agencies to deal with the caseworkers to sort things out. So I think in that way it is scalable. Whereas because you can take out a lot of wasted time and effort by simply sorting problems with people, seeing people who can solve problems rather than somebody going over and over again. So there's a lot of time wasted. I mean, I'll give an example of our ID clinic that 50 Lives 50 Homes has done. There's a problem where people lose all their ID because it gets stolen, their bag gets stolen, they've got everything. The 50 Lives 50 Homes has an ID clinic where you line up Centrelink to start with. So the person comes with their caseworker, no ID. They see Centrelink, they get a stat dec signed by their caseworker, they get income. The next one that they go to is births, deaths and marriages, because now they've got two pieces of ID. They can now actually get their birth certificate. So then I've got another piece of ID. They go to the housing department, who does the interview for the application and then does a priority interview for them. And in the space of about an hour and a half, they go from no ID to fully signed up on the priority list with multiple forms of ID, which are copied and put into their system, so if they lose them. That often takes 6 months for somebody to get through by the time they've lined it up. So it's a perfect example of what we say by we create a problem.
Yeah. So maybe just anybody comment on that? Yes. Tony, is that?
Well, look, I guess we have similar issues in the prison system with no single point of like one caseworker, and the problem that we have is, of course, you get into the bed management system when you've got a system that's full, and very often then people slip through the gap. So we know we over-assess people at Hakea, which is the state's receival prison, and because we have to get people through, because we need the beds, so their needs very often don't get addressed. So our focus is on how can we make a streamlined assessment tool so that we're capturing all of the information that we need. But it's very stressful when you've got loads of different people interacting with offenders when they just come into the system, very often with those that don't have the same level of coping skills that we may have. So you're really just re-traumatising people when they come into the system. And then the system compounds that because, as I've said, we have to move people around. So that our focus at the moment is trying to stabilise the prison numbers and actually get them down. I actually want a shrinking prison system so we can have some headroom to do some of this stuff, because there's just this tremendous strain on both. As you heard, we talk about mental health care, and which of course is all co-linked. So
yes.
I like your model. I might come and have a
Yes,
chat
there
with you
you
about
go.
it. Yeah.
Yes, please do. And maybe Jackie. Yeah.
I think just thinking about what our executive's been talking about the new department and what are the areas that we need to focus on. One of them is how we co-locate staff so that they're one-stop shop, which I don't really want to use because it means different things to different people. But if you're in a regional area, that you actually have the disability services people in the same room, same area as the child protection. If there's domestic violence support, a woman comes to that area, not necessarily identifying she's coming to a domestic violence service, but she may be coming in for a health service, and then through that sort of less obvious door is able to be have a service provide that. The balance to that is that the staff within child protection and family support or disability services don't want to be seen as generic staff. They have a professional skill background which they want to maintain and not lose. So how you balance the professionalism and the support and the specialist service that's required, rather than thinking that there's one person who can deal with all the issues. If we go there, trying to be everything to everyone will actually be disadvantage to our clients and to the people we're providing support for. The other struggle is how you actually devolve responsibility out to the regions. many of you would have worked in the regions and get so frustrated with head office that, we just want to do this. We know how to do it. We know the people. We know this will work. But head office says, well, no, you can't do that because you've got to be the same in Bunbury as it is in Columbaroo. So you can't do it differently. So it's how do you maintain a standard and approach without losing, again, that local knowledge and decision making. And, in some of the discussion we've heard today, it was speaking to the converted because you're on the end of this and we're on the end of it too, and we haven't, we don't have the answers, but we're certainly putting our minds to how we do that, and Graham's challenging us to say, it's got to be different across the state, it can't be the same. So I think it's how do you value the local casework and enable staff to be able to do their work, and always have in your mind remembering what that was like, but at the same time changing at a systems level so that funding and the hurdles to service delivery can be overcome. I think my final comment would be the fact that we're coming together as one department, whilst we have our independent budgets within that, it does allow a more fluid approach to how services are funded and provided, which is different to when, if I had to go and see Greg at housing, if I was in child protection or corrective services, you're actually sitting around the table and Graham can quite easily say, Greg, give all your money to Jackie because she needs it more than you do. Hasn't he told you that yet? No. Yeah, so that there's that flexibility for Graham as a CEO across a whole range of budget allocations. So I'll stop there.
I think that the real challenge, and it's what you talked about scalability. Our systems all need to deal with high volumes of activity and high volumes of people. Certainly the 50 Lives, 50 Homes project is the ability to work together and target a particular intensive cohort. And all of you guys will know that it's not easy, but it's capable of being achieved to get government and the non-government sector and others to work together to solve the situation for people in crisis. But how you do that at scale and how you do that in a situation where you want to maintain accountability and performance across a system and drive efficiency so we can make the money go further is going to be the real challenge. Yes, we can do it on a small number of people, but how we do it and make that systemic change and change the accountability framework and the contract management arrangements to be able to show that the outcomes are being achieved in a way that can justify the expenditure that we're all applying. So it's the ability to deal at high volume in that space.
Yeah, well, so one of the things here is that all people who are homeless are not equal, so to speak. And so therefore, everybody here knows that one size doesn't fit all. But one of the problems for government is exactly this, that it is so much easier to try and make one size fit all and to not be highly nuanced. And so that aspect is one that I think is huge challenge. But I think it's doable if you do it all in partnership. So one of the things that I've seen over the years of policy work and research and data gathering, and I want to talk about data in a minute, is that where communities and even, dare I say, blocks of people are genuinely partnering with either an agency or an NGO towards their better outcome. Things work much better, but it means that you can't just bring in, helicopter in an approach. So how are you going to try and work with that? I mean, the area I work in most is criminal justice and prisons, and there does, because it's high volume, because there's people flowing in and out all the time, there does tend to be a this is the, this is the box, and this is how we need to do it.
Is that to me?
Yeah, it's to everyone.
You're prison, right?
I've fingered you.
Prisons are never popular. Look, I think you're absolutely right. It's a volume system, and one of the challenges for us is how you get services that are designed to meet the needs of, nearly 7,000 individuals that come in to the system with a whole range of complex needs. And to a greater or lesser degree, we try and do that. But as you were saying, a lot of our services are Perth-centric, and the way our organisation is at the moment is very much a metropolitan-based service. And if I look at, just over the last few years when we've put accommodation into the system, we haven't always put the accommodation where the people need to be. So you compound the problem, and that's something that we've got to address now. Going forward, what the machinery of government changes will give us an opportunity, hopefully, to address some of those things. So that the Director General for the Department of Justice, I hope he doesn't sit and tell me I've got to give up all my money, but does have that ability to broker across a big agency, and that's what we need. So in the correction space, what we're looking at is how do we have a more regional focus, for example, so we can deal with some of the issues that Aboriginal people face. I was up in Kununurra and West Kimberley a couple of weeks ago, and a lot of that service that we provide there is really done on local innovation and local people, despite what we do in Perth. And we really want to change that, so we're supporting those people. As Jackie said, we want a framework that ensures a standard, but we really want to be able to empower people to broker services across government, so we're not leaving individuals in a position where they're sort of going on their own. Now that's a challenge, but I think there's opportunities for us to do that with at the moment, particularly in the correction space. So I'm quite hopeful that we'll be able to get some of that. We've got some big challenges though. As you heard me talk about mental health, we have a lot of unmet need in the system. We have no inpatient beds. So one of the things we're looking at is if we do put some accommodation in, is how we can make that a step up and step down facility. So
Maybe just a comment before you say that, just to follow on that, but I won't pursue it further, otherwise we'll be here all day. That it's all the work that I've done over many years. If we diverted or did early intervention for people with cognitive disability, mental health disorders who end up in the criminal justice system, you would halve your prisoner population overnight. And the evidence is overwhelmingly, I'm sure you know that.
Yep.
And so there is a really important thing for the upstream sort of services, particularly I think child protection, family services, housing, to recognise their role and the capacity that they might have, and the mental health systems, but particularly education as well, to stop that pathway, stop that train, stop funneling people into the criminal justice system, and you would absolutely reduce your prisoner population massively. So you were going to say that.
I think there's also some opportunity. You mentioned data before. As our systems and as the data gathering opportunity gets greater and more sophisticated with current technology, the ability for us to move beyond output-based contract management and expectation on individual agencies to move to a more outcome-focused model, and being able to measure effectiveness and efficiency through outcome rather than output provides great opportunity to start to systemise and improve the way we collaborate together. The other challenge is, which bringing a number of departments together does enable, is the ability to be clearer on the outcomes that we're seeking to achieve. So when you have multiple agencies, you have multiple outcomes that you are asked to deliver. those outcomes don't always interact and don't always match. So there is an opportunity through the MOG changes for a better hierarchy of outcomes to be identified, and then we're able to make rational decisions to trade off effort and to support the achievement of the higher order outcomes.
Yes.
So I think in terms of, coming back to some of those points, in terms of things like scalability and how do you do these sort of into agency ones, one of the things is actually simply to pick off your most expensive, most complex cohort, which is what we've done with 50 Lives. And they actually allow you to construct the model of care that you need for your group of people that will help them. And then once you have that in place with the difficult people, actually it's pretty easy to filter it down to the people who are not as complex, because you already have a structure in place. You also have the financial imperative to actually deal with these with the population, because one of the things, as you pointed out, is that a lot of this population is going round and round. They're not going in a straight line towards a better life. They're going through housing over and over again, hospitals over and over again, justice over and over again. So it is worth the effort to do it, because you'll actually have less people in your pool to be able to do it. Because what we're seeing is simply that money down the toilet, is that we know what the person needs, and I think the outcomes thing is really good, because in the end what you're looking for is that the person is stable in terms of their accommodation, that they have the supports that they need, and that their use of government agency money that is because of preventable illness, incarceration, etc., that is down to a minimum. So what you want to get them is to more like age-adjusted use of the government services, and it probably has to be measured over all of government, because with young people it may be justice more than health. In the middle age, it's going to be abnormal use of health systems, because they have the illnesses of homelessness and maybe some criminal justice. So I think unless we actually do adopt this multi-government agency approach, we're really going to be going round and round and round again. Yes. So this is an opportunity to actually do it differently, and not say it's my job, it's our job to do this.
Yes. And I want to ask Tim a question in a minute, but he's just going to wave. He's not going to come up. But just before that, I just want to put on notice that after I ask Tim this question, I've got two more before we finish, major areas. One is to follow up on the data question and information and data. And then finally, the concept of housing first, and explore that a little bit. But Tim, the question to you is around what mental health support and services are available for prisoners, and even perhaps more importantly, people being released from prison, and maybe just a comment about that, particularly in relation to homelessness, because we've heard, and all my research over many years shows that those two things together are absolute predictors of return to prison. If you're homeless and you increase your drug and alcohol use, and your mental health gets worse, you are significantly more likely to go back into prison quickly. So, Tim. Yep.
Yes. Can you hear me?
Yes.
I can't answer the question. Partly because of a machinery of government issue. So one thing that Department of Health, Mental Health Commission and Corrective Services were looking at immediately prior to change of government is how we better join up our services. So at the moment, I commission mental health services, health delivers mental health services and broader health services, obviously, and Child Protection Family Services was homelessness, so there was the sort of disconnected elements. With Corrective Services being responsible for all health, mental health, AOD and post-release immediate support services. So there was a complete disconnect basically between those services, which meant correctives only goes so far, obviously, outside the prison wall, if you like, and the connectedness with other services beyond that just wasn't there. It's, I have to say, still work in progress, and obviously with the more recent changes in the machinery of government, a project that Health, Corrective Services and Commission was working on about reviewing both what happens outside the wall but what happens inside. That project has had to take a back seat to some of those broader changes that everyone's already fairly pressed trying to implement. And it's, I have to ask you to acknowledge that it's not an easy task bolting agencies together and, you know, in a very short time frame. I've done it more times than I'd care to recall. So unfortunately that project is kind of sitting, but it's still on the agenda that we need to have, broadly from a policy perspective, if we want to achieve the best outcomes possible, then health, mental health, drug and alcohol services need to be delivered by the core agencies that do that work, not by a corrective services agency.
What the impact, for good or otherwise, of the NDIS and just where Western Australia is going with that. Of course, will also be a question. We've had, a group of us have been having very robust conversations with the NDIS in regard to the commitment that they should have to have support services or to provide packages and so on for people in prison. Now that's problematic at the moment.
Just MBS in prison would be a really good start.
Yeah, absolutely.
Delivering on fundamental human rights and equality.
Absolutely right, yeah. So, you know, I think that's something which, can we take it that it is a work in progress, but you're absolutely committed to be pursuing a better way to do this?
Yeah, and look, I think we have to be realistic as well. Mental Health Commission is never going to be able to walk into the corrective services system and assume responsibility for all services on a given day. I think where we failed in the past with this, trying to achieve this change, and it goes back at least 12 years that I can recall, is we've tried to do it all at once. Yeah. I think our focus needs to be on incrementally making that change. So if we're going to introduce new drug and alcohol services into a prison setting, then let the expert providers and commissioners actually do that, and let correctives focus on just keeping people safe. Okay. And let's treat people in that setting like we treat everyone else.
And maybe just to follow up, I gather that there's a proposal for a drugs prison, or a prison which focuses on drug support. Yes, so and maybe you both might like to comment on that, because that's you know, that combines mental health, drug and alcohol issues, as well as imprisonment, incarceration, and then what happens when they get out.
Yep. So I'll take this one, Tony, because I think probably need to take one for the team and navigate through a question that I can't answer. There's a number of election commitments around. I think there's 2 in-prison drug and alcohol rehabilitation facilities and a triage facility as well for new entrants into the prison system. Those were election commitments. The implementation of election commitments is subject to the budget process, so we will find out, all of us, on the 7th of September where the implementation for those is at. Obviously it's a new model of service, new facilities and so on, so there's some planning needed to go into those. But yeah, we can't really comment much because it's subject to government and cabinet deliberation at the moment. But certainly was front and centre in terms of the government's broader plans around methamphetamine action plan and drug and alcohol services more broadly.
Right. Thank you. Did you want to say?
Look, Tim's absolutely right. I mean, what we are doing internally, of course, is looking at how something would work. So we're looking at models. We have a drug prison in New South Wales, which would work slightly different to what we may have, but we are doing that. But Tim's absolutely right. I mean, it's all subject to cabinet decisions and the budget process, but we are planning and working on something.
Great, good. And maybe just to add some observations to that, because I see it in New South Wales. Post-release is absolutely crucial in this, because you can have terrific in-prison service, but if it isn't followed through properly with supported accommodation that continues to address those needs, and then it falls apart. So I trust that that's in the processes as well, in thinking about that. We haven't got a huge amount. We've got 10 minutes, is that right? About 10 minutes. So just maybe like to thank you very much, Tim. You may be called upon still. Just two big areas. So data. You heard me mention at the beginning that one of the reasons that we have developed such clear and broad and deep knowledge about the interactions and then the accumulation and compoundingness of things like mental health, homelessness, out-of-home care and so on, is that we were able to get really good linked and merged data. And Western Australia has been way ahead of the rest of Australia for years around linked health data. But with the new merged departments, how are you going with that, and will you share, making sure privacy is appropriate, share data as it's needed with other agencies? Because what that then gives you is a number of things. One, it tells you how people are being bounced around systems, and how negative that is. That can be, as you pointed out, that can be extremely negative. It also shows that the ineffectiveness of a lot of that, and it also shows the costliness of it. And it also provides points at which you can say, well, if we provided a holistic and appropriate support here or service here, it might mitigate the rest of the path. So maybe you all might like to start from the end and comment on that, if that's useful.
There's two levels of that data question. One is the individual client level, and Graham's very big on his message that he wants people to be able to tell their story once, and for agency or agencies to use it multiple times. Our agency, the bigger agency, will now come into contact with people at various levels at various times. Our ability to have one single record for one individual will allow us to capture information that we need at the right amount of information at the right time, but also be able to gather an increasing amount of information that will help us better service their needs as their circumstances change. And we will be able to work with other agencies, health, mental health and others, to actually share data at appropriate times as well. But then there's also the macro level about how well we're tracking about delivering outcomes for the collective, and being able to use that as a predictive tool. So there's great opportunity in it. It's one of the tasks. Paul's looking at me. I don't know if you've got that or Paul's got that, but certainly how we actually bring that data together and get our systems to talk. So Graham has a list of how many data systems we've got. We've got 260 sites around the state that we come in contact with people. So many sources, and how you capture it and pull it all together is enormous.
Yes, but you're doing it.
Yeah, we're starting the journey.
Starting to do it. Yep. Well, that's good news. Yeah. I mean, from your point of view.
Well, really, it's
yes.
We're in the same department.
Yes.
So we Graham is very clear about the one system to be able to access. I think for us at the moment is establishing what actually do we collect. Are we collecting the things which are simple to collect and we can get them through in our systems, or are we collecting the things which are actually going to tell us whether our business is making any difference or not? And I think that's the space I'm in relation to child protection and family support is what are the systems and what are they telling us, and how is that translating to how we're going out and asking for services. So I won't pretend that we are well along this journey, but it's very much how do we gather the information, and very much saying that whether it's disability services working with a family, whether it's housing, whether it's child protection, we all, regardless of the bricks and mortar, it gives us a window of opportunity to connect with people in our community and then build on that understanding, rather than just coming in singly and only seeing disability, singly only seeing child abuse, where it actually might be in the one aspect. A classic, in the first week that we came together, there was a case where, and it was actually tabled on the table for the executive to say, here's an example, is that housing were at a third strike for eviction. The case that came through said that the single male who was there with 2 children, there was a clear need around his behaviour to evict. However, there was 2 children, one suspected of being with a disability, and yet we didn't have really an oversight on that particular family unit. So the question is, well, if you evict, then what issues do you create for the children? Do disability services even know? Do we have any knowledge? So that was first week on the table, and I'm sure we'll see many more, but it just demonstrated if we had one system of gathering those information, that we'd be in a better position to respond.
Maybe, we'll wrap it up. I think I would like to finish, though, with just reflecting a little on Housing First. So I imagine I don't have to explain what Housing First is to people, but it's certainly not a magic bullet. But the evidence is pretty clear that the more you make people move around from, a crisis to accommodation to this, to that and the other, the worse life is for someone. And so Housing First with support services attached, and not dependent upon somebody's sobriety or good behaviour, or that this is a fundamental thing, and it speaks to the fundamental right. I'd just like to very briefly say, before asking each of you perhaps a brief comment, I've recently done some work in Sydney as an evaluation on a Housing First approach. What was the problem? What do people think? Why it sort of worked, but it didn't. What was the fundamental problem, do people think? Sorry? No affordable accommodation. So Housing First, great idea, but if there isn't the housing there to put people in, then it's not going to be a solution. So this really is a major question for government. Across Australia, we have one of the lowest rates of social housing in the world, in the affluent world, in the Western world. What are we going to do about it so that things like Housing First are immediately possible for people who are in real strife and need? Comments, especially, I guess, our housing person.
Yeah, what are you going to do with
that? You might want to start on the other end. Provide the solutions, some of the solutions.
No, look, and this is all contextual. New South Wales, vastly different situation to Western Australia now. We have, as an agency, done a lot of work in the last 8 to 10 years trying to tackle affordability, and there's views in the room that we may have put effort in wrong places and things like that, and that's all a subjective judgment. But certainly the last 2 years there's been a really, really strong commitment, and we delivered a massive investment program to build another 1,000 dwellings to tackle the priority wait list in our state, and that to us, and as the person who has responsibility for managing that wait list, I was very strong at the start that this gave us an opportunity to almost break the back of what was becoming a wicked problem for us. We've been able to do that, and our target was to halve the priority wait list for families and seniors, and we reduced it by about 62%, which was a massive achievement for us. So there has been some investment. Is it enough? Is it ever enough? We need to continue to work hard to make sure we make the most of what we do, but we also can't lose sight of the fact that people's individual circumstances and their avenues outside of the system may not be as open as we think. So we talked earlier about the way that to deal with the variety of circumstances and complexity that people have, government tries to narrow people and put them in boxes and make judgments about how long the service should be provided for. We need to make sure that we don't lose sight of the fact that everybody's still an individual and will need to move through the system. So continuing to transition people to other options to free up stock within the system is critically important. Continuing to work with the community housing sector to grow the social housing stock is important as well. But the thing about housing first is that it's not just housing first, and we can't just make it just housing. It needs to be about making sure that the support continues to be there, and that support's sustainable. A lot of the times, many of the support programs that government puts in place, again, limits the support for a period of time. So at some point, people get to the end of the pier, and whether they need it or not, the support falls away, and then some of those problems reoccur. So we need to make sure that we join the both of them. We need to work harder and continue to try and solve the problems of supply, but it's a real challenge.
Right. Can we have one more? Stephen's standing there.
30 seconds.
30 seconds.
So I think there are some very innovative ways of not just relying on government, but actually there are all sorts of ways, if you look around Australia, about how people are financing new affordable housing and using money that's out there, sometimes ultimately backed by the government. But going to a recent conference in Melbourne, there were a lot of ideas. The other is that the lack of affordable housing is completely distorting the current housing first alternatives. So things like transitional housing is full of people who need long-term housing. So there's no room for people who just need a 3 or 6 month supported period to get over whatever's happened and then move back into work. So we've got a very distorted system at the moment, but there are plenty of options where we don't say, government, you need to provide all the housing.
There's work that we're doing with Tony's people
Yes.
to actually try and work individually to find a solution, whatever that solution is for the individuals.
Great.